Good afternoon, everyone. How are you all doing today? Distracted by the sunshine outside, ready to get out and enjoy the weather? I know, me too. I can't wait. Well, thank you for joining us today. We are so delighted to have you all here. Teachers, students, supporters, thank you for joining us today. I'm Dr. Toinette Gunn. I am the Executive Director for Chicago Debates, and I have the honor of leading this amazing organization along with some of our amazing team members. We are so grateful to have you here today and to our presenting sponsor, Adtalem Global Education, for supporting another impactful public forum live. And I know that might not mean a lot to you all yet, but it will in just a moment. We're very grateful to Crane Medical Prep, Principal Toya Murray. Thank you for having us here today. Nicholas Lucas for hosting us this afternoon for this very special presentation. We are highlighting what we're referring to as a new form of debate. If you're familiar with the activity of debate, there are lots of different formats. And the format that we're highlighting today is called public forum. Public forum is a competitive form of debate that centers on current events and relies on both logic and evidence to construct arguments. So if you like to argue, this activity shows you how to do that using some of your own logic, but also evidence, which is very important. In just a moment, our students, your colleagues, your peers, will debate the highly relevant topic, the resolution: Chicago should establish more safety net hospitals to improve healthcare conditions in inner city communities. You might not know what all of that means in the moment, but you will shortly. After they debate, we're going to ask you to join us in judging who you believe was the most convincing. Because just like in any other argument, you're looking to see who was the most persuasive, who used their evidence and their logic to persuade you to vote for them. And so we're going to ask you to join us in doing that. No matter which argument you choose, we know you will be blown away by the hard work, enthusiasm, and preparation of our students. Most importantly, we hope this will inspire you to join debate next year, because we are starting a debate team here. And so we hope that this will inspire you to join and to encourage your friends to join as well. So sit back, relax, and enjoy this afternoon's presentation. Thank you.
Good afternoon, everyone. It's good to see you all. My name is Flynn Maku, and I am the Senior Program Officer at Chicago Debates. I've been working here for 3 years, and I really love it. It's my passion. I'm a former debater in high school, and I got a scholarship to college to debate, which is something you all could absolutely do. I'm here to introduce our Debate Leadership Council. It is essentially a student council before our debate week. We work with so many different schools that we wanted a way to bring students together and allow those students to both lead and give us feedback so that we can adjust our practices to make sure we're meeting students where they are and being responsive to their needs. I'm so happy that we created the Debate Leadership Council this year. It's our inaugural year. We have been able to create a debate community across the city. We have representatives from schools from the north, south, west, and east of Chicago. I have the pleasure of introducing two very impressive young women, the first of which is Blessing Bombadé, who is our vice president of the DLC. She is a freshman who goes to Good STEM, and Calistoga Frecker, who is our secretary at the DLC, and she is a sophomore at Amundsen. So can we give them a little round of applause to welcome them? Yay!
Hi, so I'm Callie Ferker, and like Flynn said, I'm a sophomore at Amundsen. I joined debate freshman year, and I started varsity this year. Debate has been a great way for me to practice leadership skills, and it's also a great space for for people with common interests, especially like politics. I joined the Debate Leadership Council for advocating for other people. It's a great space to learn how to use your leadership skills and for advocating. Some more pros for debate is it brings out, it can bring you out of your shell. So like for me, I know like COVID really ruined my freshman year. I really didn't know a lot of people, but debate was a great way to connect with people with common interests. It teaches resiliency. You're not always going to win your rounds. Like sometimes rounds are going to be harder than others, but either way, you learn a lot from it. I've learned so much from the rounds that I've pretty much like done my worst at, because it's really where you learn. When you make mistakes, you learn the most. But for the times that you win, it gives you a great sense of accomplishment. Especially for competitive people like myself, a debate team is a great way to get that like sense of accomplishment, and like hearing your name, if like for speaker awards or for team awards, it's just a great feeling. And then it also is just great for public speaking and learning to convey your arguments in a useful manner so that you can like show people your side, and also just learn how to use evidence when you're speaking with others. So all in all, I think that this is a great thing to start. So definitely join the debate team starting at Crane next fall. So without further ado, here's Blessing.
Hello, my name is Blessing Bombadé, and I am a freshman at Sarah E. Good High School. I've been competing as a debater for about 2 years now. 1 year, a part of those were an unofficial debate team. So my first year in freshman year, I kind of got an official taste in being a part of that type of community, and has completely changed my life in many different ways. In just a moment, you will hear my fellow debaters engage in a robust discussion about Chicago's healthcare challenges and realities. Our resolution for today's debate goes as follows. Chicago should establish more safety net hospitals to improve healthcare conditions in inner city communities. On the pro side of the argument, the debaters are arguing for greater investments into safety net hospitals, the institutions that are primarily responsible for serving low-income and uninsured Chicago residents. On the neg side of the debaters are going to be arguing that increased investments in safety net hospitals will not result in improved healthcare, but further prolong an existence of an ineffective healthcare solutions. Representing the pro side is Pedro Ocampo from Steinfeld High School, Malcolm Pittston from Chicago's Bold College Prep, and Armando Trejo from Steinmetz High School. Representing the con side is Ava McKenzie from Lindblom High School and Science Academy, Melik Pollard from Chicago's Bulls College Prep, and David Maduga from Chicago Bulls College Prep. Be sure to pay close attention to each argument, because at the end of the debate, you will be asked to seal and select your favorite team. Good luck, debaters.
Hello, everyone. My name is Pedro. As mentioned, I am a senior at Steinmetz College Prep. I'll be debating the affirmative side. So the status quo right now is putting safety net hospitals on the brink of closure, even though they are the primary site of care and a vital source for low-income and or Black and Brown communities. A safety net hospital is a hospital that treats anyone and everyone, regardless of whether or not they have any kind of insurance. This is through the lack of proper incentives and coordination of current policymakers. This is why we need to prioritize and securitize the finances of safety net hospitals that are already available and accessible, but in the wrong areas. A lot of these safety net hospitals are available in areas of non-low-income areas. These safety net hospitals should be vastly more available in these low-income and or Black and Brown communities, as these areas are the more typical areas where most people cannot afford any kind of insurance to guarantee help from private hospitals. They are dependent and rely on these kind of services that are available in these safety net hospitals. The reasoning for these are the following reasons. Safety net hospitals are the primary site of care and often the only available resource for patients. 40% of safety net hospital patients are enrolled in Medicaid, which is a government insurance program for low-income people. And even the help of non-safety net hospitals can help reduce the strain of caring for low-income patients. Therefore, making safety net hospitals really dependable for millions of people across the United States. This gives no reason as to why the negative side should have any right to remove this type of beneficial service to a community. Because everyone should have a right to obtain any kind of medical help regardless of their insurance plan and whether they have one or not. Hospitals are meant to help those that really need it, and everyone should have a place to turn to in emergency situations. While private hospitals may be available widely for thousands of people, there are also thousands more people who aren't able to afford these private hospitals. If safety net hospitals provide them with some kind of help, it is definitely a lot better than getting no help.
Hi, everyone. My name is Ava McKenzie. I'm from Limbo Math and Science Academy, and I am also a varsity member on my debate team. I represent the neg side as the 1NC. No matter the opportunity given by safety net hospitals in the south side of Chicago, they have an unsustainable model within the economy, which will leave them billions in debt and cause losses of jobs within the very communities that they try to help. This causes an unsafe environment in Chicago. Only revitalized development of more specialized areas challenges the high stakes of the status quo. Truthfully, we are not trying to take healthcare away, but we are trying to help. We want to add to these resources to make things better. Quality versus quantity. Instead of putting more money in safety net hospitals without good resources, we should be investing into these hospitals with better economic factors. If we don't work hard to fix these problems before they happen, we will continue to hurt the community even more. Our plan is clearly a prerequisite for the affirmative's plan of action. We need to address the fact that many safety net hospitals are on the brink of shutdown because of the economic strain they put on their neighborhoods. If we can fix these economic issues, which is what we can do with the next plan, we can solve for the affirmative's issues and our own. Safety net hospitals tend to treat low-income and elderly Black and Latino patients and often don't have enough money flowing to make ends meet. A safety net hospital, a new study commissioned by the Healthcare Council of Chicago estimated by 2024, a dozen of these hospitals could lose at least $1.8 billion combined. The report comes as one safety net, Mercy Hospital in Bronzeville, recently filed for bankruptcy and has been preparing to close this spring. 7 South Side and 5 on the West Side safety net hospitals have nearly $2 billion in losses. And because safety nets struggle to generate money, they often cannot afford to invest in their own aging facilities. And or they can't hire more specialists that would keep more patients from heading to bigger hospitals. We need to support our hospitals rather than aimlessly adding funds to hospitals that no one is going to use. Safety net hospitals can't have a good investment within a community when they are lacking in the administrative side. It doesn't matter how much money or how many individuals are able to have access to this hospital, they can get in, but they can never get treated. This is because of the lack of resources and care for nurses. This is why the nurse union should be prioritized and come as a prior question than safety net hospitals. This union says that the hospital system is short hundreds of nurses, which has led to delays in patient care and burnout among nurses. These safety net hospitals have to find new sources of funding and different payment methods as free-for-service transforms, along with government financial support, to support everyone in this new process. We need to support our safety net hospitals first. Thank you. Thank you.
All right, good afternoon, everyone. I'm gonna try to move a little over here so everybody can see me. I am Malcolm Pinkston. I'm a senior at Chicago Bulls College Prep. This is my second year on debate, and I am also a varsity debater here. I'm gonna start. All right. We are here today to debate the efficiency and effectiveness of safety net hospitals compared to their counterparts. Now, the opposition is correct in the fact that in their current state, safety net hospitals are not economically sustainable. However, it should be said for the record that the funding these safety net hospitals is also not economically sustainable. The plan of the opposition is a poisonous fruit that which carries a detrimental effect on the low-income communities and communities of color that rely on safety net hospitals for their medical care. This will put low-income communities and communities of color in a much worse place than before. They will be forced to decide whether or not they can take care of themselves, and if they can't take care of themselves, then how can we expect them to go to work and boost the very economy that the opposition claims to want to protect? The opposition is blind to the consequences of their so-called solution. We cannot continue to place profit over people, for that itself is not economically sustainable. What we need to do is, as proposed by the affirmative team, increase the amount of financial reimbursements that safety net hospitals receive. Doing this simple and worthwhile step will ensure that low-income communities and communities of color can get the medical care that they need and deserve. It will also ensure that safety net hospitals don't have to worry about breaking the bank every time a patient walks through the door. Also, as mentioned in the affirmative argument, safety net hospitals are disincentivized from caring for patients due to the low amounts of financial reimbursements that they receive. This makes it so that they cannot afford and they continue to lose money when patients walk through the door, which means they can't afford to pay those hundreds of employees that just one hospital employs, right? And it also makes it so that they cannot afford the medical equipment needed to save people's lives and heal the injured. Now, let me be clear. There are no hard decisions here, but there is a clear one, and that is to increase financial reimbursements for safety net hospitals and prevent hospital closures in the south and west sides of Chicago, respectively, which are the most affected areas in Chicago, in the city, sorry. I implore everyone here to see the desperate need for money that these hospitals have. They care for our low-income communities and communities of color, so we can no longer ignore the plight of the people who hold up our economy. We must listen to them, we must care for them, and above all else, we must empower them with the tools they need to be successful. Because there are 27 million uninsured Americans. These Americans rely on these safety net hospitals for their medical care, and it is entirely unacceptable if we defund these safety net hospitals. Now, today, in our closing arguments, you will hear from someone on the affirmative team who has had a personal experience with a safety net hospital. They will explain how a safety net hospital helped them and their family in their time of need. So listen and listen closely so that you can feel the pain of those low-income communities and communities of color when those safety net hospitals are defunded. Those 27 million Americans will no longer have access to health care. Thank you.
Hi, everyone. My name is Malik. Nice seeing you all. You all look nice. Anyway, I just, okay, sorry. Safety net hospitals sound good on paper. They're institutions built on the principle that no one will be denied care, regardless of their ability to pay or the severity of their condition. However, what we see in actuality is a faulty and underpaid system that harms the vulnerable communities they claim to protect. Wasteful spending, unsanitary environments, and poor medical distribution are rampant among Chicago's safety net hospitals. The affirmative says we should continue these institutions. They want to invest more money into them. We say the solution is not to flood a failing model, with money, it will be unable to manage responsibility, but to invest money into low-income communities directly by preferring the creation of quality care institutions that will uplift and aid the community as a whole. According to the Illinois Health and Hospital Association's report, safety net hospitals throughout Illinois and Chicago are facing significant operational changes as a result of their operational model, which contracts the majority of their services through Medicaid managed care organizations. The affirmative argues the government should use the existing tax exemption framework to address the issue of additional funding. However, we have two responses to this claim. The first is that this additional funding will need to be more than $2 billion annually to make up for the forecasted loss of analyst Kristen Schorsch is expecting. This is an unrealistic amount of funding the Illinois government and Chicago could expect to receive. The second response is the affirmative's position to ignore people's lobbying power of medical industry. The affirmative argues that the government should invest more money into safety net hospitals because they will solve a desperate need for medical support in low-income communities. We say that the government should not invest more money into safety net hospitals in order to relieve economic strain. If the government were to invest more money into safety net hospitals, they'd have to start borrowing substantial amounts of money that will pressure public investment and other safety net hospitals, leading to inevitable collapse of healthcare in low-income communities. Our argument is substantially better because we offer extreme benefits to communities in need. And that's it.
All right. Hello, my name is Armando Trejo. I'm from Steinmetz College Prep. And in conclusion, affirmative has overall expressed valid and good reasons as to why safety net hospitals should be taken account. Most low-income communities heavily rely on these safety net hospitals in case of an emergency. Whenever a crime happens, the person in question will always be transported to the nearest hospital and for care, no matter if they have insurance. Their life always comes first. Personally, my family 3 years ago used a safety net hospital for an emergency for a family member. My family member did not feel that well on that day and collapsed on the couch and was close to suffering a heart attack. My family at the time was not financially stable. If it weren't for that safety net hospital that took care of my family member, I would have faced a tragic loss on that day. As expressed in the opening statement, safety net hospitals are a primary site of care. Whenever you have an injury that must be treated, you should always have a place to go right away. Safety net hospitals should be necessary in every community to ensure the safety of the people across the city. Lastly, 40% of the safety net hospitals are enrolled in Medicare. Having patients from low-income communities being able to handle all their billing and be able to take care of it rather than having overwhelming amounts of debt from those hospitals. Even some of my family members are just afraid of these hospitals and calling 911 since the amount of debt they'll fall into. The negative fails to understand the impact and success of safety net hospitals can really do at saving lives and save everyone. Thus, in conclusion, safety net hospitals should receive better financing and proper policies to ensure the safety of the people.
That's great. This on? Okay. So my name is David Maduga. I am from Chicago Bulls College Prep, and I'm a junior, and I'm on our team's varsity team also. The affirmative team argues that the government should give more money to these safety net hospitals by reallocating funds from other programs to solve their problems. The negative team argues that they have an unsustainable model within the economy, which will leave the United States government billions of dollars in debt. and will also lead to the loss of jobs within the very communities they are trying to help. No matter how much money they receive, if we don't fix the root of the causes, then all this money for these programs are useless. Christine Schur's study showed that the south side of Chicago's safety net hospitals have lost an expected value of $2 billion in total. This is not a small amount of money to give back to these areas to help them again. Wasteful spending is what caused this. This shows that the resource pool of safety net hospitals was greatly diminished, leading to overworked nurses and staffing shortages, causing even more problems, making nurses burnt out and delays in treatment. If safety net hospitals cannot even give basic treatment to its patients, then what is the point in giving money to them? I have seen firsthand the terror of seeing a loved one sitting in the waiting room, waiting to receive treatment that was desperately needed. This experience was when my grandma was bleeding out of her nose nonstop for hours. And when we arrived at this hospital, we were waiting in a 5-person line who had similar problems or worse. If this hospital was managed correctly and it put its money to good use, then this would not have happened. I will recite this again. These safety net hospitals do not need any further funding. This money can better be used to protect communities of color and give patients the treatment they deserve by solving the root of the problem in these communities and relieve the economic strain in these communities by creating the quality care institutions in these communities of colors presented by the negative team. This is the reason why we should vote negative. Thank you very much for listening to my speech.
No, I think you all can do better than that. Can we give them a round of applause? And I want to, before we pass it to our judges, I do want you to understand that participating in debate takes time and it takes effort. During the last 2 to 3 weeks, each of these students have gathered with me on Tuesday and Thursday evenings to prepare for this event. So we just want to honor them for their time, for their effort, for leaving their schools today and coming to debate in front of you, which I'm sure is a little nerve-wracking. So we're very proud of you and thank you so much for making the case. We're going to pass it to our lovely judge. Today on our panel, we have our future co-coach, Coach Jackson, representing Crane. Crane, can you show Coach Jackson some love? There we go. We have our lovely executive director for Chicago Debates, Dr. Toynat Gunn. Can we give Dr. Gunn some love? And a very, very, very special warm welcome to Courtney Anderson, representing Adtalem Global Education today. They are the reason the event is happening. Thank you so much. So I'm going to pass it to Dr. Gunn to lead our judges panel.
All right. Well, before I offer some comments, I have to ask by show of hands, how many of you were familiar with safety net hospitals and the challenges with them before this public forum? Okay, a little bit, others no, not so much. I think that's just a real example of, what we have said about this activity and how it really does increase your knowledge. Now, you all feel pretty confident at this point to have an argument with someone about this topic, right?
Yes.
And I'm sure you would win because you have evidence, you have studied this information, and all of that to say is you have made our decision really hard. Am I correct? You've posed very strong arguments on both sides. I love the introduction of the personal stories because that really does, in our minds, we're always hearing about things, but when you hear real life situations and how people have been impacted by what you're talking about, I think it just sits and resonates with us a little differently. So thank you for introducing that and sprinkling that into the debate. We appreciate that. I think you all did a fantastic job, seriously, in being able to, one, describe what safety net hospitals are, what the challenges are, and what some possibilities are for us to address the problem. And so Thank you for your hard work. I am excited to continue to learn more about safety net hospitals myself. I had to ask Anthony when he introduced the topic to me. So what is a safety net hospital? And so I love learning, and I learn so much every time I watch you all debate, and I get very excited. So thank you for helping me learn today. And I'm going to pass it over to Coach Jackson to give a few comments as well.
I love everything about this, guys. I love the confidence. I can't wait to bring this to Crane, because we're gonna be debating whether or not to go to an out-of-state college or university or an in-state college. That's what my students are facing right now, right? How much money do they want to spend going to college? And I love that this is what I want to bring to college. I love the whole decision is just so hard in my mind. Not trying to be biased on which side to really agree with, or, but looking at the speakers and how confident they were, I enjoyed that as well. So good job, guys. I appreciate you guys coming, and I hope you guys in the audience are looking forward to being on stage next year as well and saying what you believe in, what you affirm, or what you negate.
So that's hard to follow up one of those. But you all did very well. This is my first time judging or being in this environment at all. I'm very impressed with how much you all brought to the table and just the data that you had to support it. I am a data person. I use it a lot in my role, actually, to determine what direction we're going to go into. So I really liked that was brought. In some of my feedback, yes, I will always love more data and more things to back up why a decision is made. But yes, just to follow up on everything, I'm very impressed with everything today. It is very hard. When the topic was mentioned today, I felt in my head, yes, safety nets, that sounds like a good plan. But then when I heard from both sides, it definitely made me think more, and that's what your job is to do. So just great job all around.
All right, students, so it's your turn. Are you ready to crown the winner? Okay, y'all can do better than that. Are you ready to crown the winner? So because y'all been so quiet, I need you to use your voices. So we have our pro team and we have our con team. If you think the pro team should win today, can you make a little bit of noise for me? Okay. If you think the con team took it home for you, they were the most convincing, can you make a little bit of noise? I don't know, that feels kind of even. Some of y'all didn't make any noise. Let's try this one more time. If you think the pro team won today, can you make a little bit of noise? Come on! All right, and if you think the con was most convincing, can you at least give them a little love? Come on! I don't know, what are we calling it? Do we do it one more time? Is it still a time? Okay, you really gotta convince me which side should win. Last time here, if you think the pro side won, I need you to make as much noise as possible. Let's go. Okay. And those who love the con side, can you make a little noise? Here we go. It sounds like to me that our pro side won. Can we give them some love? Come on, won't you stand up? Give a bow. Good job, everyone. There you go. You may be seated. Thank you so much, students. I appreciate the enthusiasm. All right, so we have a little special segment here. I'm going to invite our longtime supporter, Dick Sullivan, to join me here on stage. Because one of the things, students, that debate can do for you is not only get you into college, but it can help pay for your college. One of our program officers right there in the back, Flynn Maku, they told you that they went to school for what, friend? How much did you pay for school, Flynn? I didn't pay anything. Oh, man. And why didn't you pay anything for college? Because I made it in high school. Ooh. Got a scholarship. Now, how many people want to go to college for free, whether you go in-state or out-of-state? Some who don't have their hand up right now. How many people want to pay the federal government for the rest of their lives? Anybody? No, okay. So we want to do something special. We have a scholarship that we are giving out for the very first time today to one of our debaters, and they don't even know. And the scholarship is actually named after Mr. Dick Sullivan and his family. So I would love for Dick to come and tell you a little bit, really briefly, about why we're giving out this scholarship, and then I'll tell you who won, okay? Why don't you welcome Dick as he comes?
Thank you. Is this on? Yeah. Excuse me. Thank you very much. I got involved with debate in 2001 by accident, so to speak. I almost quit after the first time judging, but I stuck it out, and now I'm sort of got the bug for a long time. My mother has always been a primary force behind this. As soon as she saw that I was excited, she said, "What do I want to do? What can I do?" So she has very nicely funded a scholarship that we're going to be giving out over the next 10 years. And that's because what she wants is a chance for kids who otherwise wouldn't have a chance to learn the skills of debate and to carry those to college. For those of you who haven't figured out yet, when you get to college, you're going to find your debate skills put you ahead of everybody. It becomes immediately obvious to you that you know how to do research, and most of them don't. So your ability to think logically, your ability to argue, all of those will be strong things when you get to college. But first you have to get there. So in this case, I'm really pleased with what I hear on the table here. These guys, as far as their future and what they're going to mean to this country. So I'm very pleased, and my mother is very pleased, who, by the way, her 106th birthday is on Wednesday, next Wednesday. Woo! That's why she's not here presenting. But anyway, very much I appreciate this opportunity to give some encouragement to you guys. I wish I could give it to you all, but in fact, I hope it'll be encouraging to everyone. Thank you.
Thank you. Thank you, Dick. We appreciate it. So today, one of the debaters, what you don't know about him is that one day he wants to be president of the United States. He's already creating his campaign slogan. He is going to the United States Naval Academy in the fall, and he is our very first inaugural winner of the Sullivan Scholarship. Won't you help me congratulate Malcolm Pinkston? Now, Malcolm, won't you tell the people why they should vote for you in 2040?
Well, like I said in my rebuttal to the opposition here, friendly opposition, we have to empower the people who we are supposed to govern. Is this my phone? Oh, yep. We're supposed to empower those people. And so what I want to do when I'm president, not if, is empower those people with the tools that they need to be healthy and successful.
Thank you, sir. Y'all gonna vote for Malcolm today? There we go. Well, that brings us to the closing of our program. Say, aw. Now, what I want to know is how many of you, after seeing today's presentation, will join the debate team next year? I already got some hands. Come on, stand up. Let me see you. There we go. Wow, there we are. I want to introduce you to two individuals. You've already met one, but in the back to my right, your left, Coach Nicholas Lucas is going to be our debate coach next year. Can you show him some love? And Coach Jackson will also be his co-coach. So next year, come on, you could do better than that for Coach Jackson. So next year, when you see us walking around your school trying to promote the debate team, we want you to remember our faces. And while I'm at it, I just want to invite our staff to stand on their feet really quickly. I just want to thank them for their support and helping pull this together. Devin, Stephanie, won't you stand? Stephanie, in the back, we have Mr. Derek. Come on, give him some love. In your left there, we have Flynn back there. Thank you, Flynn. And running the camera today, you all don't see her, but Lauren's right there right up front. So thank you, Lauren. Again, we just want to thank Crane, Principal Murray, Nicholas so much for your hospitality. Students, we thank you for your attentiveness today and participating in the program. We look forward to seeing you next fall when we start the debate season. Have a good day.